Also, I'm somewhat concerned about the increased potential for numbers of appointments as a result of participating in a clinical trial. Can some of my appointments be done via telehealth or at a local clinic instead?
So this is again a very important logistical question, and what I can tell you is the answer to this question can be variable. So this is based on, the reason I use the word variable is because this is based on the type of agent that is being investigated. So if it's an early phase trial where an oral agent is being investigated, and in some cases there are intravenous agents that are being investigated, so there's a difference in what type of agent is being tested, which brings into different aspects of the monitoring that are taken into account when we decide how often a patient has to come in. As I mentioned, phase 1 trials also involve a good amount of research component where blood gets taken from a patient after obtaining consent, and this is to understand what the drug is doing in the body. So that may change the number of visits, and that can be variable. And I understand the context of this, especially in the setting of COVID-19, when a lot of healthcare providers have shifted towards telehealth appointments. And we have, in some circumstances, depending on the type of trial the patient is on, we've been able to provide telehealth appointments where we talk to the patient, assess their side effects, understand how they're doing, and at the same time they're able to get blood work closer to home, let's say if they have a 2 to 3 hour drive or beyond that. And again, this is all very dependent on the type of trial and the clinical investigator team that you're working with, but of course, special circumstances require specific flexibilities. For example, during COVID-19 pandemic, a lot of clinical trial teams were trying to conduct clinical trials in a way that was very easy for patients, but it can be variable. So accommodations can be made, but there's a lot of other factors that need to be taken into account before a clinical trial team can tell a patient that if they can do certain things at home or if they can't do certain things closer to home.
I'll just add that in general, participating in a clinical trial 1, 2, or 3 is probably slightly more visits at a minimum than compared to the standard of care. So you probably are going to see your provider or the clinical trial nurse have imaging or lab visits a little bit more frequently than you would if you were getting just the standard of care. And I do think that it is something that people should be aware of. Because again, the burden of travel or time away from work, those things can be very important for patients, and it can be one of the limitations in terms of their ability to participate.
That's exactly one of the things that I am concerned about. I wonder, will I be able to work? Will I be able to take care of my family while I'm on this trial?
Sure. And Dr. Chino, please feel free to chime in. I can tell you that, as long as a patient is in a stable condition, they can take care of their family and they can maintain their normal routine when they're on a trial. However, there are chances that an individual may need to make adjustments because they may experience side effects because of which they will have to make some adjustments to their normal schedule. And part of that could also be from trial requirements, as Dr. Chino mentioned, the number of visits. Sometimes certain trials require hospital admissions for a few days and a few days of monitoring. So all those things need to be taken into account, and you'd have to discuss that with your clinical trial team as to what those requirements are for that particular trial. So that if you need to make adjustments to your work schedule or family situation, that can be made possible after you discuss with your clinical trial team.
And I'll add that for some people that don't have a clinical trial that they're eligible for that's near them, they do travel to receive clinical trials. So for example, if people going to the National Cancer Institute to receive a clinical trial or an NIH drug, then maybe they wouldn't be able to work, or maybe they would have to get caregivers for their family because they would just quite simply be away from home. And that, again, is one potential barrier or obstacle in terms of getting access to it. And it's one of the reasons why trying to, for me, I'm a big advocate of trying to make clinical trials available to people all throughout the United States and in many different community centers. And it's been a big push for large advocacy efforts to try to bring clinical trials to the people versus bringing the people to the clinical trials.
I see.